everyone. I'm going to have fun here now because he's a very good friend of mine and a colleague of mine in the Department of Management, Dr. Paul Swiercz here. So I asked him continuously to come to this session because he's going to instigate some very interesting thoughts and some challenging thoughts as well. So Dr. Paul Swiercz, thank you for coming.
Welcome.
You kind of are in both domains, in the business world, but also you came from the health care or the health industry here. So tell us explicitly kind of your two hats that you play throughout your history or your time, your experiences.
Well, early in my career, I had aspirations to be a member of the healthcare industry, and it turned out that I ended up being a medical technologist and was certified by the American Society of Clinical Pathology. So I did that job for a while, and then I liked healthcare, and I ended up moving over to public health and went to the University of Michigan for a degree in public health, became involved in environmental health. And then after that, I thought I wanted to know something more about organizations and business. So I took my healthcare interest and worked on another master's and PhD and did early significant research in the healthcare industry. Particularly around questions about who's working there, okay, and how is it structured, how is it changing.
So you looked at the workforce, or you looked at the professionals in the healthcare industry, but other industries as well. So let's get to the discussion here. Explain to us the workforce. How do you see the workforce in the healthcare industry? It's changing. It's definitely changing here. Everything is changing on how we define them, how we compensate them, how we evaluate them. What's your take on all this evolving change or disruptive change that's happening?
Well, of course, this disruption is occurring everywhere. Okay, so healthcare isn't unique in that regard. But I guess I would argue that the disruptions in healthcare are closely related to the uniqueness of healthcare. And one of the things that I think makes it particularly unique is the structure of the workforce and how it has emerged over time, particularly the professionalization and the occupational categorization of the healthcare delivery system.
Explain a little bit more how do we evaluate them in a system where, in business world, if you don't perform, you're out. But in the healthcare, it doesn't follow that system clearly, right? It's kind of an intricate or complicated system.
Well, I think performance is consistent across all organizations. The healthcare system standards of performance, or maybe consequences of poor performance, can certainly be more significant for the patient. But I think that is a particular challenge, in part because of the healthcare industry. Social responsibility is unique. People look to the healthcare industry unlike hospitality. You can't run a hospital as though it's a hotel, but certainly there are aspects to the hospital that are related to the hospitality and how the patient receives care, and that's part of the performance appraisal. But the expertise required to deal with infection control in the hospital has meant that there are people who are professionals in cleaning a room, cleaning a surgical suite, making sure that the hospital doesn't become a vector of disease rather than a place where one goes to recover from disease. So those are some of the unique challenges that are associated with healthcare.
Can we argue that healthcare is neither private or public? It's a combination of both?
Well,
or is it one or the other?
Well, I mean, it's historically, up and through the 1970s, most of healthcare was either nonprofit, charitable, Sisters of Mercy, other religious groups. Lutherans would have their hospitals, Presbyterians would have their hospitals, Catholics would have their hospitals, and then of course you had community hospitals where the community really supported it, and then of course you had more governmental hospitals, particularly the VA system. The idea of private healthcare is a relatively recent phenomenon, particularly on the scale that we have it on now. I think the industry is still very much trying to figure out how to deal with this different mix of players in terms of to whom the hospital is accountable. Okay, particularly when we're talking about the for-profit hospitals and how one judges a fair pricing system and a fair reward system in that context.
And we talked about a business model for hospitals or for the health industry here. Is it fair to apply a business model to a healthcare industry? Or is it something that we should take caution of? I come from the business world. Mm-hmm. For me, a business model is a way of operations, right? To figure out what is the inputs and the outputs and how to measure them and how to compensate them. But a business model also takes into account the human capital that's involved in it. You're an expert on human capital, right? The definition of what a worker is. Explain it from that aspect. What is your definition of human capital in the healthcare and the private sector? Do they relate, or are they somewhat in contradictions?
Well, I think there's actually two questions in there. One is the notion of the business model, and so I'm part of a group of people who rejects the idea that conventional business models, in terms of the for-profit sector model of business, the kind of model that's made, the great private sector enterprises that we have in the United States, I think that's not well suited to healthcare. And I think we have been trying to force fit it to healthcare for many decades and haven't been successful. And I would really like us to do a better job at confronting those differences and finding better approaches to dealing with those differences. The second part of your question has to do with the human capital. And I think one of the very unique things about healthcare is what I call its intensive credentialism, the degree to which people need assurance of competency. And one of the ways that we have crafted over time to provide assurance of competencies is to create mechanisms for giving people certificates of accomplishment that say, yes, I can do this. I can do X-rays, I can do nuclear medicine, I can do physical therapy, I can, almost anything I remember when phlebotomy, drawing blood became a vehicle for certification. So there aren't very many jobs in healthcare where people aren't, either by regulation or by expectation, to seek some kind of certification. And then trying to manage these various interest groups within healthcare and whose domain, where's the responsibility reside, under which of these various certification programs is challenging.
On the topic of human capital, and we had long conversations about this, and you're doing a lot of research there, and actually you teach a very popular class at GW. We talked about the employee, the model employee, and how it does for many years. The organizational man, and I think it was Wright that wrote the book. And yet we now move into something called the knowledge worker. Mm-hmm. You have some new compelling ideas that you're putting forth and saying, let's re-examine this. Talk about what you teach in the class when it comes to this definition of what is an employee, and try to relate it to this new healthcare domain that we live in.
Well, the healthcare, in terms of the employment domain, probably the single biggest challenge for healthcare has been the relationship between the players like the insurance companies and most specifically the physicians. The physicians in the U.S. model, beginning around the turn of the 20th century, following the Flexner Report, really positioned themselves as independent professionals. And so they culturally and historically have never thought of themselves as preparing to be employees. They have prepared themselves first and foremost to be professionals, but then secondarily to create and manage a practice, and manage their own careers through the practice. And then of course they do practice groups and things like that, and have relationships with. I'm using the hospital as an example. Their workshop that is the hospital. That's still unresolved. Now, in probably in the last 20 years, you've had a group of physicians appear that are called hospitalists, and now these are physicians who actually are resident in the hospital, and depending on how it's arranged, are oftentimes employees of the hospital. So they're not really managing an independent practice anymore. But many other arrangements are such that the physicians are really in a form of contractors, and you have a web of contracts, and so different parties are merging together at different places. In terms of the hospital, that's a place where you have a pretty stable workforce, but you also have people, these contractors, kind of flowing in and out of that workspace. So that's a real challenge. The other thing with regard to some of my course and research, I'm very intrigued by, you refer to it as a knowledge worker. I think that's a classic and important term. It was first introduced in 1959 as you know, by Peter Drucker. And I think it's showing its age a little bit in the sense that the knowledge worker was valued primarily because they had this base of knowledge and it couldn't be kind of accessed unless the individual gave it. That's still true, but I think there's a new, more emergent challenge or group of workers, and I'm calling these the cognitive workers. And the cognitive workers are differentiated from the knowledge workers in the sense that it's just not a question of kind of recalling and applying knowledge that they have. But the cognitive workers are those who are part of the knowledge creation part of the enterprise. And so to kind of try to fit it into this discussion as best I can, we just had the situation now where the Google machine beat the Go player.
Yeah.
Okay.
The Korean.
Go
specialist.
Go player, and Go is like 10 times more complicated than chess, and so it's like this, significant leap in demonstrating the capacity of machines. Well, when I'm listening to that, I'm thinking about medical diagnosis. Okay. And how a classic physician's key skill was the knowledge and then the capacity to take kind of obscure signals from a patient and craft them in to a diagnosis. I think there will be people who will soon be arguing, like Google argues with regard to driving or flying an airplane, that most diagnoses are going to be better made by machines than they are by physicians. And I think that's a kind of disruption that's going on.
So that's why I said to people, I said, watch out, he's going to be some radical ideas coming out here. So let's talk about this cognitive, what do we call him, cognitive worker?
Yeah.
Is that the right word, worker, for it, or cognitive individual?
Well, I mean, if you're kind of selling your labor for money, I call you a worker. Okay, I call that work. When people are delivering in pursuit of compensation, I call that work.
So let's do the adjacent universe here. We have MBA students coming here, mm-hmm. right? And let's move them away from being knowledge acquisitioners. Mm-hmm. Let's call them cognitive students. Mm-hmm. How do you see them play out in this new MBA domain, in this new education system? Because everything is available on Google. What we're talking about here, they can download some digital books, quickly watch some YouTube videos. What's differentiating us, and how does that fit into this new challenges that are coming out where innovation is changing the rules of the game as we speak, but it's always been there?
Well, I'll try to approach that kind of in a healthcare setting, in what's happened to healthcare over the last 50 years anyway, and probably longer than that. But in kind of classic healthcare, when we had the physician as the brain, let me call it that for for lack of a better way. And then, I was as part of medical technology, I was part of something that was then called the allied health professions. And these people were also often referred to as physician extenders. These were occupational groups in healthcare that were intended to be like the implementers of the knowledge and skills of the physicians, to extend them, to make their assistance more accessible. Well, what's happened is that there's been a realignment of responsibilities. And it's not to say that the role of the physician has been in any way diminished, but what we now know is that good health care requires a much broader distribution of responsibilities and authority, and a much, much higher level of collaboration across all of the various people who are part of the healthcare delivery system. To the extent now, I'm particularly intrigued by the degree to which contemporary medicine is embracing alternative healers. The massage therapists and dietitians, healthcare people, and exercise experts in exercise and things like that. So we've got a much broader universe of players. And the skills, going back to your question, I think much of our educational system in healthcare in particular has been focused on acquisition at the individual level of a set of professional skills, with less emphasis on the skills required for the integration across these various categories or skill groups. So we're going to, going forward with the cognitive workers, we're going to need people who have what we might call more advanced integrative skills, where they can see connections between all of these different options and all of these different needs to craft the personalized healthcare experience that people need.
Let's go back to you, right? You advocate for a whole new model of learning, and you usually in business schools or in other schools, you give students a business case to analyze, right? And you tell them, here's the case, here's the challenges, go solve the problem. Yet you've turned the tables a little bit on the students, and you said, I don't want you to provide me with solve me the solution for the case. I want you to actually write me a case. Talk a little bit about your model here and why this is important from a cognitive perspective.
Well, I think there's two components to the learning in the university and in the business school, and one is the skills acquisition. So, if we're talking about finance, you got to know how to do the mathematics of finance. If you're an accountant, you got to know the rules. If you're an HR person, you've got to know compensation and selection, and there's lots of techniques. So that's really hard knowledge. But and it's very important. But especially when we get in the MBA programs, in the MBA programs in particular, we're trying to educate people. It's a terminal degree, and we're trying to educate people, for work that's going to express itself over the next 2 to 3 decades, because they're not going to come back for the MBA after they've got the MBA. So we're trying to prepare them with a very long range perspective and a set of skills that prepares them for that. Many universities have found that the case method and case learning is a powerful tool for doing that, and I agree with that. Where I began to develop my own point of view on it, however, was that when I was teaching these cases, my students were constantly looking for the solution. It's a classic scientific management perspective of that there's one best way, there's one best answer. There's, it's accounting or chemistry or whatever. What is the answer to this problem? Let me write it down. Well,
Google it.
Yeah. In reality, I'm really a fan of systems theory and the systems theory notion of equifinality, which really means is that actually there's probably multiple right answers. Okay. And the more complex the system, the more difficult it is to find a right answer. So a cognitive worker, a successful leader, has to have that capacity to create answers that are unique to the complex situations that they're facing. So what I did is I began challenging students to write case studies. And so I call it SWIFT learning, student written, instructor facilitated case writing, SWIFT case writing, okay? The idea is that having the students write their own cases makes it real for them because they draw on something that they value, some kind of event or challenge that they value. But more importantly, it causes them to understand the limitations that are associated with learning from other people's cases. That we in our school and in our management department, we're very much into lifelong learning. We're very much into experiential learning, and that really means learning from the experiences you're in, okay, as your career unfolds. And just to kind of go one step further, and that brought me to the most recent course that I've been working on, and that's called Critical Thinking Skills for Executive Leadership, where I'm trying in particular to enhance the ability of leaders to critically, not cynically, but critically analyze their work environments and become part of the solution, and then communicate that to the people that they're working with in a successful way.
Thank you. One last question.
Okay.
Your history at GW.
Mm-hmm.
Why GW? Why come learn at GW? What's so unique about it?
Well, let's kind of acknowledge that most of our lives are controlled by serendipity. Okay, so there's a big serendipity component to coming to GW. I happened to be in the labor market when GW needed somebody, and when I saw the opportunity, I said, why wouldn't I want to go to GW? Okay, it was one of those experiences that said it would be kind of silly for me not to take an opportunity to be part of a great university in one of the great cities of the century, and so that's what I've been doing for almost for a long time now. Okay.
Great. Thank you for your time.
Okay.
All right, and I appreciate it, and there'll be more to come.
All right, great. Thanks for being with, sharing.
Thank you very much.
Thank you.
Okay, so the debrief on Paul Swiercz. I told you he was going to be controversial, but controversial because he raised a lot of good points for us to reflect on here. He challenged my notion of the knowledge worker, right? He introduced this whole concept of a cognitive worker, someone that co-creates knowledge, right? That looks at knowledge as more of as a resource, but at the same time, how do we co-create it? He coupled this with his whole SWIFT manual, which is don't give me the solution. There's many solutions to the problem, right? Help me write the case to look at it from different angles here. That's a very interesting take as you move forward with your MBA program and with this course, right? Especially the introduction course, especially this intro course, looking at it from a perspective saying there's many solutions, many angles to look at. Bring your cognition, bring your thinking skills here, and start critically analyzing the different challenges that there are and looking at it from an opportunity perspective. Kind of rethinking this whole concept of what is employment, what is the employer-employee relationship here? What's the doctor's roles? What are the healthcare professionals' roles? What's the role of the CEOs? What's the role of hospitals in this whole spectrum, right? I don't have the answers to this, and I don't think anybody does have the answers to this, but just reflecting on it is maybe starting the process of critically thinking about things. And that's, I think, why we're all in here, is to start critically thinking about the challenges that we face today.